Abdominocentesis, I would expect you would know, that's a surgical puncture to withdraw fluid from the abdomen. I'm not going to ask you about ALT or ALP. Now, amylase. Now, amylase is the digestive enzyme, or amylase might be referring to a test. Chyloplasty. Kyle has big lips and wants them repaired. Cholecystectomy, you know that means surgical removal of the gallbladder. Colostomy, surgically creating a new opening in the colon. You've probably heard of colostomy bags. And here's an illustration of one, of an ileostomy, colostomy. So ileostomy versus colostomy, it all depends on where does it need to be. Does it need to be in the last part of the small intestine, or is it going to be somewhere in the large intestine? So you can imagine that can't be very pleasant. ESWL, do you know the abbreviation ESWL, extracorporeal shockwave lithotripsy. Extracorporeal, outside the body. Shockwave, using sound waves, lithotripsy, to crush stones. The bilirubin, the SGOT, just be able to put that as a test in this chapter. Gastric lavage, therapeutically washing out the stomach. Hernorrhaphy, you could define that. And you know what a biopsy is. Now some other things. Stool culture and sensitivity, just like we can tell a lot about a person's health from analysis of their urine, you can tell a lot about a person's health by analyzing the feces, the stool. So a hemocult, literally hidden blood, hidden blood. Now, also called stool guaiac, guaiac. And so that's a test to test for bleeding in the digestive tract. Now again, find humor when you can. You may not find this amusing at all. But the hemocult test, if you've never had to do one, so and again, unless they've changed the processes, people are given this little cardboard piece of cardboard, and they're to take at different time periods, they're to take swabs or samples of their feces and put it on this card, and then that is sealed up and sent off to be analyzed. Well, I had people tell me two stories. You decide if you find them amusing or not. At one medical office, one lucky person got designated to deal with all those hemocults coming in, and so her office mates decided to play a game on her, a trick on her. So they got a baby roof. I think you know what a baby roof looks like, and if you've seen Caddyshack, the uncut version of Caddyshack, you can imagine that it does look, a baby roof could look like a feces, a turd, as a common called, and they put this baby roof in the package. And so they were trying to distract her while she was opening this stuff up so that she wouldn't see the size of it. And then so the person they were playing the gag on about had a heart attack when she saw the size of that, what she thought was a specimen. But her office mate thought it was hilarious. Another thing not quite so hilarious, again, this gentleman comes into the office, I was told, and he's carrying a bag, a plastic bag, you know, kind of thing you get at Walmart or the grocery store, one of those plastic bags. And he walks into the office, and he's holding this plastic bag a mile away from his body. He's holding it as far away from his body as he can. And he comes in and supposedly had a thick accent and said, "Here's my stool sample." And they, the office staff, they about panicked. They improperly judged this person based on his accent that he was naive enough to have put actual feces in the bag. It's like, no, he had his little card all done like he was supposed to. He just wasn't getting anywhere near it. So, a couple of what hopefully you'll find amusing digressions. Techniques of treatments, you know, MRI, CAT scan, really that's called CT scans now. A barium swallow, barium is a radioactive material, actually swallowing it so they can get some images. Cholecystography, you could define that. A barium enema would be different than a barium swallow. Lower GI series, cholangiography, fluoroscopy is actually you're taking your x-rays or images and actually able to see them on something like a TV screen in a way. Ultrasounds, you know what those are. PTC, ERCP, do learn ERCP, endoscopic retrograde cholangiopancreatography. No, it doesn't have to be a spelling word, but do know ERCP. And NG tube, that would be a good abbreviation. So nasogastric tube, Gavage. They're different scopes, so again, depending on how far in the body it gets. Esophagoscopy, gastroscopy, colonoscopy, proctoscopy, sigmoidoscopy, peritonoscopy. And there's an illustration of a gastroscopy. There's a sigmoidoscopy. You get to the ripe old age of 50 and they want to do those every 10 years. And been told you do, again, you're going to be anesthetized, given some medicines to make you not feel anything, and I have been told that they're such good drugs that you should not, in addition to not driving or operating heavy equipment, you should not make any decisions within the next 24 hours because evidently you could be talked into selling your house for $1. So sigmoidoscopy, oh yeah, there's going to be some kind of medication involved to keep the patient from feeling pain. Pharmacology. Antacids, literally against acids, so your Pepsid ACs, all that kind of stuff. Tums. Antiemetics would be against vomiting, so a $5 word for vomit, regurgitation. Cathartic. Make sure you know what cathartic means. It means both of these things. It's going to make you vomit, and it's also going to relieve constipation. So you're going to be going at both ends. But like a cathartic experience, you will feel better after. So cathartic, make sure you know cathartic. Antidiarrheals, you can imagine what that's for. Antispasmodics would be to stop the spasms. Laxatives would be for constipation. Now, antihyperglycemics and antihypoglycemics or anti-hypoglycemics, using your word elements, what do those mean? Now, abbreviations. Make sure you know AC, before meals, antisebum. I guarantee you somebody's going to choose a different abbreviation for before meals or after meals. So A is not after. A is anti, before. Do know BA for barium. Do know BE for barium enema. Do know BID, twice a day. You know what a CT scan is. Do know EGD, esophago-gastro-duodenoscopy. Do know ERCP, endoscopic retrograde cholangiopancreatography. GE. Do you know GE? Do you know GERD, G-E-R-D? Do you know that one? GI, I assume you know that one. And GTT, glucose tolerance test. We're not going to get into all the hepatitis viruses. IBS, make sure you know that one. LES, make sure you know that one. LFTs, make sure you know liver function tests, MRIs, everything on this page. So N and V for nausea and vomiting, NG, nasogastric, NPO, nothing by mouth. PC, after meals, post-sebum, so don't confuse AC and PC. PP, postprandial, make sure you know that one. We're going to move on. QID 4 times a day. So BID, TID, QID. There's TID. And UGI, upper gastrointestinal.